What's up, sickle cell warriors? Today in this video we're going to talk about 4 things. What is sickle cell disease? How do you inherit it? Who is most commonly affected by it? And I'm going to tell a little story of about how I was diagnosed with it. Sickle cell disease is a blood disorder that has abnormal sickle cells. So in sickle cell disease, your blood is shaped like a C almost. And so what happens is, when the blood is flowing, the blood gets collapsed into your blood vessels, and that's what usually causes the pain. Another way you call it is the vaso-occlusive crisis. But that's pretty much when you get increasingly significant pain. Now, I know sickle cell warriors, you probably know what sickle cell disease is, obviously, but I think it's very important that we talk about what it is exactly and that we know exactly what it is, so that when we can better understand it and know how to treat it. So I have a clip describing what exactly sickle cell disease is and what happens when the pain occurs. Okay, so let's go watch it together.
In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
As you can see, we have abnormal sickle cells that are shaped like a sickle. That's why it's called sickle cell. And so when it goes through the blood vessels and when it gets stuck in there, that's how the really bad pain occurs. So it's important that we understand that, so that we pretty much know that proper blood flow is what keeps us healthy. And so when we can keep our blood flowing, that's how we can avoid going through the crisis. So later on, with future videos, I'll be more able to explain how to keep the blood flowing, how to stay oxygenated, and to stay healthy. So how do you inherit sickle cell disease? Well, in sickle cell disease, there are 3 types of genes to be aware of. We got the normal hemoglobin genes, then we got the sickle cell carrier trait, and then we got the sickle cell genes. So as you can see in this image, if you have 2 parents who have the AA hemoglobin or the normal hemoglobin genes, then there's a 100% chance that your kids will not have the disease and will not inherit it. Now, if you have one parent who has the normal hemoglobin genes and another parent who has the sickle cell carrier trait, there's also a 100% chance that your kids will not have the sickle cell, will not get sickle cell. But there's also a chance that your kid can become a carrier of the disease, and and potentially give future inheritance of the disease itself to other people. Now, if there's 2 people who have the sickle cell trait, then there's a 25% chance that their offspring will get the disease. And then there's a 50% chance that the offspring will get the carrier trait. And then there's a 25% chance that they will get just the normal hemoglobin genes. And then lastly, if both parents have sickle cell, then there's a 100% chance that obviously that the whole offspring will have sickle cell. Now, why that's important, hopefully if you're dating somebody or you're talking to someone who has sickle cell, you definitely want to disclose and ask if they have the sickle cell trait, because you don't want to, potentially cause your offspring to have the trait, But that's something that's up to you to decide, and definitely be aware of when you're speaking to other people. Now, who is most commonly affected by sickle cell disease? People with sickle cell disease tend to be African American or African. For example, I am Nigerian. I was born in Nigeria. My name is Ikechukwu Okweriku, And that's why you call me Dr.O, because it's just easier to say Dr.O instead of a clerical. And so other people who also have it are Latinos, Asians, and Indians. And in this map, you can kind of see where it's spread out. Now, if you notice, it's very concentrated in Africa. And you might be asking yourself, why is that the case? Now, if you didn't know, sickle cell was originated because it was actually formed to go against malaria. And malaria is pretty much the disease that is given by mosquitoes in Africa. And in Africa, there's a lot of those type of mosquitoes that give malaria. So in order to evolve and get over that, there was the sickle cell gene that got mutated in the offspring in order to combat the malaria. So that is why sickle cell disease is heavily concentrated in Africa. So here's a personal story of how I was misdiagnosed with sickle cell. Like I previously mentioned, I was born in Nigeria, and unfortunately in Africa, they don't have as medically advanced technologies as they do in America. So what happened was, when I was born, I was misdiagnosed and they said that I didn't have any sickle cell disease. But it was not until I moved into America a couple months later that I realized I had sickle cell disease. And so after being in America, that's when I got diagnosed properly and learned that I had sickle cell disease. Now, the reason why I'm telling this story is because, unfortunately, there's a lot of people in Africa and the Caribbean islands who get diagnosed with sickle cell and they don't even know they have sickle cell. So imagine what kind of pain they've gone through. I actually met somebody with sickle cell disease who I met in America but grew up in Haiti, and she told me that whenever she had a sickle cell crisis, what would happen is people would just assume that there was demons inside of her. So no one would want to help her, and she would just go through incredible pain. So that's why I just wanted to tell that story, because that in itself is an issue that in some countries can't even diagnose people with sickle cell correctly. So hopefully I can bring more awareness to that issue, and hopefully more people can get diagnosed correctly. Alright, sickle cell warriors. Well, anyways, it was a pleasure speaking with you. If you have any questions, please don't hesitate to ask them down in the comment section, and I would definitely be more than happy to answer those questions. And you know, just to update y'all, I plan on uploading once a week every Wednesday. So hopefully you guys can stay tuned and see me more often every Wednesday. Anyways, thank you, sickle cell warriors, and again, thank you so much for blessing me.